Well, representatives from the CDC continue to tell us the Ebola virus will not make it to the U.S. However, every day we see video of the precautions surrounding two patients transported from West Africa to Atlanta Hospital. And we are waiting for those results of a third man in New York who was tested for possibility of Ebola. Dr. Stephanie Detterline with Medstar at Union Memorial is here to explain the concern that we have in the U.S. right now. Thank you for coming in.
Absolutely. Thanks for having me.
Sure. Now, briefly tell us what Ebola is.
So Ebola is a virus. And viruses are very simple organisms. Now, simple doesn't mean they're not dangerous, but they're very simple. It has one strand of genetic material that sort of forms a hook or a loop that you might see in pictures because of the way the proteins relate to each other.
Okay.
So it's a single-stranded RNA virus that is highly infective.
And I mean, my goodness, is what, 90% it kills the patients that actually receive it?
Yes, the case fatality rates is anywhere from 60 to 90%.
Okay.
The important thing to understand, though, is those fatality rates have a lot to do with the location in which the disease usually presents itself.
Well, and that's the other concern, because every time the CDC says something, you see everyone almost bubble wrapped. They have special planes being brought in. They spray everyone down. So they're saying, oh, don't worry about it. It's never going to come to the U.S. But you're saying, well, then why are they taking so many precautions? Is that overkill? Right.
So certainly not overkill. It's a highly virulent, highly infective virus, so it is a very dangerous entity. I think the reason the CDC is saying don't worry about it is it has natural reservoirs in those countries and has never been seen naturally occurring in the United States. So it would be extremely unlikely for that to occur for people to contract the virus in a natural way in the United States.
Okay, so then contracting it, let's get a little bit closer.
Sure.
I mean, you have to have fluids transported. So are we talking about needles here?
Exactly.
Are we talking about kissing?
Great question. Great question. The two really important things for your viewers to understand is that in order to be contagious, the patient has to have symptoms. So they're not symptomatic, or they're not contagious before they have symptoms. Okay. So you're not just going to run into somebody in a movie theater or an airport. Patients have to be very, very ill before you can contract the virus. Again, you have to touch their body fluids. So that includes urine, feces, saliva, possibly sweat. But you either have to touch that very ill person or touch their remains. So that's why this threat of epidemic is actually very low if we follow appropriate health procedures.
We keep hearing very low. Real quick before, this is the last one I can have you.
Sure.
But what's your percentage, you think, of the likelihood of it coming to the U.S.?
Well, other than, the likelihood is there if patients travel from those areas, which is why there's a restriction. Okay. But coming to the U.S. without our knowledge is very, very low. Okay. Most of these patients we have identified. They're here because we brought them here for better care.
All right, doctor, thank you so much for coming in. We appreciate that.
Absolutely. Thank you.